Okay, let's start with something quite stark. Imagine this, a disease so common in Pakistan that it hits 1 in every 8 women.
Mhm.
And tragically, it leads to about 40,000 deaths there every single year.
It's a staggering number. And globally, it's the second most diagnosed cancer. We're talking 2.3 million new cases worldwide each year.
And that's breast cancer. But for so many, understanding it, even talking about it, is just, well, it's surrounded by silence, isn't it?
Yeah,
And misinformation.
absolutely. Which is why today we're doing a crucial deep dive. We've been looking at a recent webinar transcript from the Fatima Jamal Memorial Welfare.
Right.
It featured Zubayada Sattar, who's a human rights activist and assessment expert. And our mission, really, for you listening, is to pull out the key bits of knowledge.
The vital stuff.
Yeah, the vital stuff on prevention, detection, treatment, but also importantly to understand those cultural and systemic hurdles.
The ones that delay diagnoses, especially in South Asia.
Exactly those. They have such a profound impact.
So, okay, what are we covering? We'll look at what breast cancer actually is, the definition.
Mm-hmm.
Then, really importantly, the key symptoms for early self-detection. What should you be looking for?
Crucial information.
And we'll touch on those alarming statistics again, globally and nationally, just to grasp the urgency.
And then dive into those societal challenges like this Eastern shyness concept and the real problems with healthcare access.
Yeah, the things that lead to those tragic late diagnoses. We'll hear some powerful personal stories, too, that
Oh,
really bring it home.
definitely.
And finally, distill it all down to actionable steps. What can actually be done? Awareness strategies for everyone.
Sounds like a plan. So this organization, Fatima Jamal Memorial Welfare, they actually started back in 2020, right in the middle of the COVID situation.
Ah, interesting timing.
Yeah, and their focus shifted specifically to breast cancer only about 2 years ago. It was after a seminar with a Dr. Reena Kumari. That's when they apparently really grasped the scale of the problem. And they saw this double hit, the high cost of treatment and this major cultural barrier.
This Eastern shyness you mentioned.
Exactly. That's the term they used. It
Yeah.
really stops women from talking about their illness or, getting help when they need it.
Could you unpack that a bit more? Eastern shyness?
Yeah.
Is it about modesty or stigma? Or just this societal pressure that makes it taboo, especially body parts considered private?
It's really a mix of all those things. It's complex. It goes beyond just personal modesty, though that's certainly part of it.
Right.
It's woven into cultural norms, societal stigma around women's health, particularly, yes, anything to do with breasts. There's this deep
A
discomfort.
sense of shame almost.
Yes, a sense of shame in discussing these really personal medical things, especially, say, with a male doctor or sometimes even within the family.
So to stay quiet.
It leads to silence, and that silence delays conversations that could literally save a life. It's a huge societal weight-keeping vital information hidden.
That makes so much sense, sadly. And it's clear organizations like Fatima Jamal Memorial Welfare are trying to push against that silence.
They are. They've held big seminars, brought in top oncologists like Dr. Saima Zahoor from JPMC. That's a major hospital in Karachi.
Jinnah Postgraduate Medical Center, right?
Correct. And the expert in this specific webinar, Zubayada Sattar, she works as an assessment expert in Balochistan. She's also a human rights activist.
Vice President of the Women Rights Association of Pakistan.
Yes. And her connection is personal and deeply affecting. Her own sister-in-law was diagnosed, but at stage 4. And that kind of devastating personal experience, it just highlights the urgency of everything we're discussing.
Absolutely.
So when we talk about breast cancer, okay, what's important, it's this uncontrolled growth of breast cells, right? Forms a lump, a tumor. But the really terrifying part is how efficiently these abnormal cells can spread, metastasize.
Right, invade nearby tissue.
Exactly. Then into the lymphatic system, the lymph nodes, and then potentially anywhere else in the body. It just gets exponentially harder to treat.
So every day really does count.
Every single day. It's a race against time.
So given that speed, how do we catch it early before it gets a chance to spread like that? The webinar really focused on, I think, 3 main symptoms for self-detection.
Yes, 3 key things. And they might sound basic, but they are the first line of defense.
So what's the one sign people maybe miss? Or the one you think, if more people knew this, it could make a huge difference?
That's a really good question. Because, people might know about checking for lumps or changes in size or shape. Those are crucial.
Sure.
But nipple inversion, where the nipple suddenly turns inward, That's a big one. Or any nipple discharge that isn't milk, especially if it's bloody or clear.
Okay, those are quite distinct.
They are. But perhaps the more subtle sign, the one often dismissed, is changes to the skin, like dimpling.
Hmm.
Or a little pit forming, sometimes described as looking like an orange peel.
Orange peel texture, right.
Yeah. That texture. It might seem minor, but it could mean a tumor is pulling on the skin. If you notice any of these, even if it seems small, that's your signal. Get it checked.
Don't ignore it.
Definitely don't ignore it.
And stepping back to the broader picture, the stats are just, well, they're sobering. WHO's 2022 report mentioned 2.3 million new cases globally each year.
Second most diagnosed cancer worldwide.
But Pakistan's rate being so high in Asia, that's striking, and also the fact that it seems to hit women earlier there, often between 30 and 40.
Yeah, that is a vital point. In many Western countries, it typically appears more in the 50s age range.
So what could be driving that difference, that high rate and earlier onset in Pakistan?
Well, there are likely several factors. First, Pakistan doesn't have a comprehensive national cancer registry.
Ah, so the numbers might even be higher.
Exactly. We could be under-recording cases and deaths simply because the data isn't fully captured. That lack of data is a problem in itself. Second, there might be genetic predispositions in the South Asian population, perhaps environmental factors we don't fully understand yet, contributing to that earlier onset.
Right.
And third, critically, is this persistent issue of late diagnosis we keep coming back to.
Which connects to that truly shocking statistic.
Mm.
50% to 70% of cases in Pakistan diagnosed late, stage 3 or 4.
It's staggering. And it's not just a number. It's stories like Zubayada Sattar's sister-in-law.
Diagnosed at stage 4.
Yes, after having symptoms for a long time. Initially misdiagnosed, just given a cream for a lump.
Oh, no.
All because of that lack of information, the cultural shyness, the societal traditions that just delayed her getting proper medical help for months.
It's heartbreaking.
It really is. It's a chilling example of how these delays become fatal. And you see the ripple effect in the healthcare system, too.
How so?
Well, major cancer hospitals like Shakat Khanum, they often have to prioritize stage 1 and 2 cases because, frankly, that's where they can save the most lives.
Right, the chances are much higher then.
Much higher. So while that policy makes medical sense, it underscores the dire outcome if you miss that early detection window.
And it's not just about knowing the information, is it? It's the practical hurdles. Like in remote areas. Zubayada Sattar mentioned her family in Kashmir.
Yeah, she described how awareness there is almost non-existent. Her village has no health units at all.
None.
None. To even get a basic checkup, you might have to walk like 4 to 6 kilometers just to reach a main road.
Wow.
Then find transport to a doctor, only to find the local hospital doesn't even have the right diagnostic equipment.
So they get sent elsewhere.
Exactly. Redirected to the district headquarters, maybe even as far as Islamabad. That could mean delays of up to 3 days just for a consultation.
3 days lost in a disease like this.
That lost time is incredibly damaging. It's critical time wasted.
And this cultural barrier, this shyness, it's not just in remote villages, is it? Sadia Asim shared that story about her sister.
Right. An educated woman living in a city.
Yes. And still struggled with discussing medical details, especially with male doctors. Avoided even saying the word chest, used euphemisms instead.
It just shows how deep these societal norms run, doesn't it? It creates this huge obstacle to open communication and therefore timely diagnosis, even for people who technically have access.
It really does. Education alone doesn't seem to magically fix it. It highlights the complexity. So, okay, knowing all this, what are the concrete steps? The webinar really hammered home that the first most crucial step is self-breast examination.
Absolutely. Empowering individuals, educating yourself, educating younger generations about recognizing those key symptoms we talked about.
The changes in size, shape, nipple discharge, that skin dimpling.
All of those. Being familiar with your own body.
And then, if you do notice a change.
Then the next step, absolutely critical, is a clinical breast examination by a proper healthcare professional. Don't wait.
And that's more than just feeling for a lump, right? You mentioned diagnostics like mammography.
Exactly. Because things like mammograms, which are low-dose x-rays of the breast, they can often detect abnormalities that are way too small to be felt.
Years before you might feel a lump.
Potentially, yes. They look for subtle changes in the tissue. Getting that early visual information is potentially game-changing.
Because, as we keep saying, caught early.
It's highly curable. The challenge is when these vital steps, self-exam, clinical exam, screening, get delayed or just aren't available.
Which seems to be the case far too often, leading to those late diagnoses.
Precisely. Lack of awareness, limited access to clinics and hospitals, not enough screening programs, they all contribute massively.
Okay, so that's detection. What about prevention?
Yeah.
You touched on lifestyle earlier, diet, weight. What are the most impactful changes people can make?
Well, obviously things like age you can't change, but focusing on what you can control is key for prevention. Maintaining a healthy weight is really important, especially after menopause. Obesity is a risk factor.
Right.
Regular physical activity helps too, even moderate exercise, like brisk walking most days. Limiting alcohol intake is advised. And diet-wise, aiming for a balanced diet, lots of fruits, vegetables, whole grains, cutting back on processed foods and red meat.
Standard healthy living advice, really.
Pretty much, yes. These aren't guarantees against cancer, of course, but they are genuinely powerful preventative steps within our control.
And if it is detected early, what do treatments generally look like? And why is tackling the cost so critical in places like South Asia?
So early stage treatment usually involves a mix of things tailored to the person. Surgery is often first, maybe a lumpectomy, just removing the lump, or a mastectomy, removing the breast. That might be followed by radiation therapy to kill any remaining cells locally, or chemotherapy. Those are drugs that target cancer cells throughout the body.
Right, the systemic treatments.
Yes. And sometimes hormone therapy or targeted drug therapies are used too, depending on the cancer type.
That sounds like a lot and expensive.
Extremely. It's multimodal, often takes a long time, needs specialized centers. The cost is immense. For many families, especially lower income or in rural areas, it's just prohibitive.
So an early diagnosis doesn't help much if you can't afford the cure.
That's the harsh reality. Access to affordable or subsidized treatment is just as crucial as early detection.
Which brings us back to needing organized efforts to tackle all this. Seminars, awareness camps. You mentioned schools, colleges.
Absolutely essential. Normalize the conversation early on. Make it part of health education.
And community drives.
Yes, community health drives, public-private partnerships, especially finding ways for women to deliver awareness sessions to other women. That can help bypass some of the cultural reluctance.
Like peer education.
Sort of, yes. And encouraging regular screening.
Right.
And really targeting remote areas with specific programs. TV and print ads don't always reach there.
So you need to physically go there. Mobile units.
Exactly. Physical sessions, mobile screening camps, bringing the information and the care directly to those communities.
So let's try and wrap our heads around this. What does this all really mean for you listening right now?
Well, I think our deep dive today really shines a light on just how critical early detection is. Life-savingly critical.
From that basic but vital self-breast exam, looking for those changes. Size, shape, nipple discharge, skin dimpling, to understanding why you need professional clinical exams and accessible screening like mammograms, the message is just so clear. Knowledge plus early action saves lives.
It really does. And we've seen how these deep-seated cultural barriers, the lack of awareness, the poor access to healthcare, especially outside big cities, it all creates this huge challenge.
Beating that awful statistic, 50–70% of cases in Pakistan found late. Stage 3, Stage 4.
And we heard those heart-wrenching stories. Zubayada Sattar's sister-in-law, Stage 4, after years of symptoms. Sadia Asim's sister, educated, urban, still struggling with that shyness with doctors.
They're not just numbers, are they? They're real people, real families. It reminds us why this conversation is just so urgent.
It absolutely does.
So this leaves us with a question, maybe a challenge for everyone listening. Knowing that early detection makes breast cancer so much more curable. And understanding these really entrenched cultural, practical, systemic hurdles. What's one concrete step that you could take in your own life, your own community?
Could be anything, right?
Yeah. Maybe it's teaching a younger sister or daughter about self-examination. Maybe it's pushing for better community health initiatives where you live. Or maybe it's simpler, just challenging that shame or silence around health issues in your own conversations.
Small steps can make a big difference.
Exactly. How can you contribute, even in a small way, to a future where more lives are saved and fewer women have to face Stage 4 in silence? Something to think about.